I just wanted to learn a little bit about Sunday liquor sales.
Well, there's on the ballot there's a special referendum that would allow Sunday sales after 1 o'clock on premise, basically in restaurants. This was in response, if you recall, to ABC changing their regulations a year or so ago, where you used to go in on Sunday and buy a private club license, and they changed that after years of operating that way to make it where you either had to be a private club or a restaurant. So we passed legislation, put it on the city's ballot back at the mayor's race, and put it on here. It's already passed in the city, but this will include the whole county, the city, and all the other citizens in Houston County. It's strictly on premise, and it's primarily if you go into a one of the local restaurants or something and want a glass of wine on a Sunday afternoon with your meal, it allows you to do that. Doesn't allow any off-site sales, doesn't allow the convenience stores or grocery stores to sell it on Sunday, just on premise.
This is a statewide push by the ACCA to get this money. If the counties were doing better financially, do you think that they'd be in favor of this?
I think they would. I mean, we're always hoping to make our roads and bridges better. The ACCA is for it, but so is Alpha, the road builders, several other organizations that see it as an opportunity to create jobs in the state, and certainly I think that's the gist of it. The negative about it that people have is that it's coming out of the Oil and Gas Trust Fund, which certainly we have some concern about that because we get revenue from that fund.
Right, that's why I was asking.
But it has a cap on it. If the fund gets down below a certain amount, then the money that will be created by this Amendment 3 stops. So it won't let it deplete it beyond a point that it really impacts us financially. So.
Now, I heard the engineer talking about some money that's coming in from FEMA. Was this money already accounted for in the budget, or is this new money that will be added to the budget?
No, this is money that was between last year's budget and this year's budget was put in there. Our engineer let us know what the costs were and what would be put in there. The problem is it's just been very slow in coming. Some of the monies, we don't even know exactly how much it is. There are some large projects that they pay 100% for, and those projects are still ongoing. So we had to, based on engineering numbers, we had to put that amount in the budget. Yeah, it may be more, it may be less than that amount once the project gets done, because again, on those large ones, they pay us actual cost.
So barring anything unforeseen, we have all monies accounted for in the budget as it stands now. There's no new money or no money we found or anything like that that's going to be added to the budget.
No, not unless these projects end up running more than the cost estimates were. I mean, if that was the case, then there would be additional money. But based on the numbers we were given and the information FEMA gave us about when the monies were coming in, it should all be in the budgeting process. I think we've got about $1.2 million more that we're waiting on altogether. Now some of the money, I think the auditors made us capture some of the money in last year's budget because it was a receivable last year, if you will. The work had already been done, so it's a mesh of the two budgets.
I wanted to ask about the doctor in the jail.
Well, he's gone.
About how much do we pay the doctor each year? Or?
I'll have to look that up.
So I think in the contract says 4 hours. Is that 4 hours a week or 4 hours a day?
What's the contract say?
I couldn't tell from the contract. So
I know it when I read the contract, but I can't tell off the top of my head.
Who would know? Maybe call the sheriff later and ask him about that?
Gary would know, or the sheriff, or I can, if I look at that contract when we get through, I can tell you.
Okay. And let's see, is this something, how do you select the new doctor? Is that something that has to be bid out, or?
No, it's professional services, and honestly, it's difficult to find someone willing to do it. Working with inmates as a doctor is significantly different than having patients come to your office or working in a hospital. So finding someone to do it is the challenge. Dr. Banner has done an outstanding job, and we would expect nothing less from the new doctor and appreciate him being willing to work with us.
All right. Have there been any lawsuits recently about health care in the jail? Or?
Yeah, have there been any lawsuits? Not that jump out at me. That didn't mean it hadn't happened. I mean, most of those go through the sheriff's office because the sheriff is constitutionally responsible for the jail. So.
Okay. All right. I think that's all I need to know.
A few months ago, we started a project with getting the location in the CAD system about the fire hydrants.
That's right.
You and I've spoken this week. Where are we with that project?
Well, I hoped to have an announcement today and still hope to have it one day this week. We're working with a couple of different entities, Troy and others, to make that happen. That is extremely important to us. It's important to the firefighters out in the community, and we've been told that the only issue is about getting it into the system is they don't have the location. So, you know, either we've got to get someone to go out and volunteer to do that. That's something I really don't want to put on volunteers, or what we're pursuing now is possibly asking local university students as part of their training to go out and do it. Some of that was done when the city did all of their identification of fire hydrants and manholes and sewer lines and those kind of things. So all we want are the fire hydrants. So it's a simple project. It's just getting physically somebody to go out and do it. Once we get that information, then we can put it into the CAD system and have it identified for you guys that need it.